Have you ever wondered when your brain is most at risk for a stroke? Most folks think it's in the middle of a stressful event, maybe while you're rushing, upset, or under pressure. But the truth is, the most dangerous time of day for your brain might actually be the first 30 minutes after you wake up. I know, that sounds shocking, but I'm here to tell you the clinical truth. That quiet moment, when you're just starting your day, still lying in bed or sitting quietly, that's when your brain can be in real danger. And here's what makes it even more frightening. Most people over 60 have no idea that this moment of calm is actually a window of risk. You might be doing everything right. You take your medications. You try to eat healthy. You keep yourself moving when you can. But if your morning habits aren't quite right, you might be unknowingly increasing your risk of stroke before you've even had breakfast. That first cup of coffee you reach for, or the quick jump out of bed, could actually trigger something far more serious. But let me tell you this. There's good news. Very good news. This risk? It's not permanent. It's not a life sentence. Medical research has shown that just a few small, simple changes to your morning routine can cut your stroke risk dramatically. In some people, it's a reduction of up to 50%. And I don't say that lightly. You see, I've spent more than 30 years working as a brain doctor. I've helped thousands of patients recover from strokes. But my deepest purpose has always been prevention. That's what this channel, Stroke and Heart Attack, is all about, giving you the tools to protect the most important organ in your body. We're not here to scare you. We're here to empower you. Because I've seen, time and again, how small changes can lead to huge differences in your health, your independence, and your peace of mind. So let me ask you something. Have you ever felt dizzy when you stand up? Do you wake up with your mind already racing, thinking about the day ahead before your feet even hit the floor? If that sounds familiar, this message today, it's for you. Today we'll walk through 8 gentle, powerful habits every person over 60 should know. They're simple, they're backed by science, and they fit into real life, your life. As we go along, I'd love for you to share in the comments, which habit do you already follow? And which one are you ready to try tomorrow? When you comment or share this video, you might inspire someone else to protect their brain. And please, before we begin, tap that subscribe button. It helps us reach more folks just like you, people who care about living well and living strong. Now, let's begin.
Habit number 1. Drink water right after waking up. Before coffee, before tea, before anything else. Just 1 glass of room temperature water, about 12 ounces or 350 milliliters. If you're not doing this yet, please don't feel bad. Most people aren't. But this one small habit might be the simplest way to lower your stroke risk during those fragile morning minutes. Let me explain why. During sleep, 7 or 8 hours, you're not drinking anything. Your body slowly becomes dehydrated. You lose moisture through your breath and through your skin. Even if you don't feel thirsty, you wake up mildly dehydrated. And here's why that matters. When you're dehydrated, your blood becomes a bit thicker, a little like syrup instead of water. That thicker blood doesn't flow as smoothly. It's more likely to form clots, and clots are the leading cause of ischemic strokes, which make up nearly 87% of all strokes. But the moment you drink water, just a glass, it rehydrates your system. It helps thin your blood so it flows the way it should. It also helps your kidneys flush out waste that built up while you slept. Many of my patients say that one simple habit helps lift that morning fog, the dizziness, the heaviness. It wasn't age, it was dehydration. And if you take morning medication, especially for blood pressure, water is not optional. It helps the pills dissolve and absorb properly. Without it, your medication might not work as it should. So tonight, keep a glass or bottle by your bed. And tomorrow, before you even stand up, drink it slowly. That's your first protective step.
Habit number 2. Take 5 minutes of quiet, deep breathing. Now, I know what you're thinking. Is that really going to help? Let me tell you, yes, it absolutely can. Have you noticed your brain racing as soon as you wake up? Appointments, family, the news, it can feel like a mental storm before the day has even started. But that flood of thoughts triggers a real physical reaction. Your body releases cortisol, your stress hormone. And high morning cortisol raises your blood pressure, constricts your blood vessels, and inflames your arteries. That's a dangerous mix for stroke risk. But there's a way to counter it, and it only takes 5 minutes. Here's how you do it. Sit up in bed or find a comfortable chair. Close your eyes. Now breathe in slowly through your nose to the count of 4. Hold gently for the count of 4. Now breathe out slowly through your mouth to the count of 6. That long exhale, it activates your vagus nerve, a calming switch for your entire nervous system. Repeat that cycle for 5 minutes. That's it. No apps, no equipment, just you and your breath. Studies show this kind of breathing lowers your heart rate, relaxes your blood vessels, and helps bring your blood pressure down. It's also wonderful for memory and focus. Try it tomorrow, right after your glass of water. Just 5 minutes to settle your mind and protect your brain. Do you think this is something you could try adding to your morning? Let me know down in the comments. I read them, and so do others who may need a little encouragement. And if you're finding these tips helpful, please consider giving this video a gentle tap on the like button. It truly helps us reach more folks who might not realize how much power they already have to protect their brain and heart, one small habit at a time.
Habit number 3. Gently stretch your neck and shoulders. You might not think your neck has anything to do with strokes, but let me explain. The main arteries that supply blood to your brain, the carotids and vertebral arteries, run through your neck. And when the muscles around them are stiff or tight, they can actually squeeze those arteries, reducing the blood flow to your brain. That's not something we want. So take 2 minutes. Gently stretch. No pain, no quick movements. First, tilt your head slowly to the right, like you're trying to touch your ear to your shoulder. Hold for 15 seconds. Now back to center, and do the same on the left side. Then look straight ahead. Tuck your chin gently down toward your chest. Feel the stretch at the back of your neck. Hold that for 15 seconds. Now, inhale. Lift your shoulders up toward your ears. Hold. Then exhale and drop them. Do that 5 times. This helps ease tightness, improves blood flow, and gives your brain a fresh, steady supply of oxygen. You can pair it with your breathing routine for a strong start to your day. Habit number 4. Eat a low-sodium, high-potassium breakfast. This might surprise you. Even if you don't eat junk food, many breakfast foods are loaded with salt. Cereal, bread, cottage cheese, even soups and turkey slices. And in the morning, your body is extra sensitive to salt. Too much sodium first thing makes you hold on to water. It raises your blood pressure and forces your heart to work harder. For someone already managing hypertension, that's a dangerous combination. So here's what I recommend. Lower the sodium, but also raise your intake of potassium and magnesium. Potassium helps your body flush out excess salt. Magnesium helps relax your blood vessels. Try plain oatmeal with a banana and almonds, or 2 boiled eggs with avocado and spinach, or a smoothie with Greek yogurt, berries, and chia seeds. The goal is to keep your total sodium for the day under 1,500 milligrams. One salty breakfast can blow right past that. Start your day with real food and give your brain the nutrients it needs.
Habit number 5. Gentle morning movement. After a full night's sleep, your body has been still for hours. If you go from dead to the kitchen chair, then to the living room chair, your circulation stays sluggish. And for older adults, that kind of stagnant start quietly increases your stroke risk. But there's an easy fix. A short, gentle walk. Just 10 to 15 minutes. Not a workout. Just steady movement. Around the house, down the hallway, out to the porch, or maybe around the block. Movement activates your leg muscles, which work like a second heart, helping push blood back up to your brain. It also improves oxygen flow, supports blood vessel flexibility, and helps regulate your blood sugar. If you walk outside, the morning sunlight resets your sleep-wake cycle, which means better sleep at night and even lower stroke risk. And if walking is tough right now, that's okay. Even gentle marching in place while holding a countertop for 5 minutes can help. The goal is simple. Wake your body up with movement. Habit number 6. Check your blood pressure each morning. Let me be very clear. High blood pressure is called the silent killer for a reason. You don't feel it. There are often no symptoms until it causes real damage. That's why this habit matters so much. Check your blood pressure every morning. The best time? After you've been awake a few minutes, but before your coffee, food, or exercise. Sit quietly. Use a cuff-style monitor on your upper arm. They're much more accurate than wrist monitors. Take your reading, then write it down. Keep a notebook right next to the device. Date, time, reading. This gives you and your doctor a clear picture of your daily patterns. And research shows people who monitor at home have better control over their pressure and a much lower risk of stroke and heart attacks. You become the CEO of your own health.
Habit number 7. Take your medication exactly on time. Now, if you do nothing else from this list, please do this one. Take your prescribed blood pressure or heart medication at the same time each morning. I've seen it too many times, patients who delay or skip a dose because they felt fine. But here's the hard truth. Those morning surges in blood pressure can be dangerous, and they happen most often right when most people wake up. That's exactly why your doctor prescribed that pill for the morning. It's designed to protect you during the most vulnerable hours of the day. So take it after your glass of water, before food, before coffee. Use a daily pill organizer. Set a phone alarm. Tie it to a habit like putting on your glasses. And please, never stop or adjust your dosage without talking to your doctor. You feel fine because the medicine is working. That consistency, that's your lifeline. And if you have a tip that helps you remember, share it in the comments. It might help someone else who's struggling to stay consistent. Do you have a system that helps you remember your medications each day? Maybe it's a pill organizer, a phone alarm, or simply tying it to your first glass of water. Whatever works for you, I'd love for you to share it in the comments. Your small tip could make all the difference for someone else who's struggling to stay consistent. And if this message speaks to you, please subscribe to Stroke and Heart Attack and share this video with someone you care about. It's free, and it just might be the reminder that helps protect their health too. Habit number 8.
Stand up slowly and in stages. That moment when you rise from bed, it seems harmless, but for many older adults, it can trigger a sudden drop in blood pressure. We call it orthostatic hypotension. It causes dizziness, even blackout spells. And for some people, it can lead to a mini stroke or worse. But there's a beautifully simple solution. Don't rush. When you wake up, first swing your legs over the side of the bed. Sit there for 30 to 60 seconds. Take a few deep breaths. Then place your feet on the floor. Use a nightstand or sturdy furniture for support, and slowly push yourself up to stand. Pause again before walking. This gives your body time to adjust to gravity and blood flow. It prevents the sudden drop that can harm your brain. It takes 1 minute, and it could save your life.
Now, let's go over the 8 simple habits one more time. Drink a full glass of water right after waking. Take 5 minutes for deep breathing. Gently stretch your neck and shoulders. Choose a low-sodium, high-potassium breakfast. Move your body for 10 minutes. Check your blood pressure each morning. Take your medications on time. Stand up slowly, in stages. You don't have to start them all tomorrow. Just begin with one, whichever one feels easiest to you. Maybe it's putting a glass of water on your nightstand tonight, or setting your pill organizer, or doing that gentle neck stretch. These small steps build on each other, and over time, they create a fortress of protection around your brain. This isn't about fear. This is about confidence, knowing you're doing what you can to stay strong, sharp, and independent for many years to come. Thank you so much for spending this time with me today. If this video helped you, please give it a thumbs up. And don't forget to subscribe to Stroke and Heart Attack. It's free, and it's one more way you can protect yourself and the people you love. Share this video with someone you care about, and let us know in the comments which habit will you try first. Take care of yourself. Be well, and I'll see you in the next video.